You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Shawn Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hey, I'm Ivan Zach, excited to introduce a colleague of mine, Dr. Andrew Rosenfeld. Dr. Andrew Rosenfeld is a DVM and a boarded practitioner. Has been practicing small animal medicine and emergency medicine for 31 years. Dr. Rosenfeld shares a passion for education and love of animals with his wife. Their marriage has culminated in the establishment of Veterinary Education Network Support and Advocacy, or VENSA, a live community for the mentorship and support of new graduates in the art of general practice. Andrew, welcome to the show. Thank you for finding the time.
Thank you very much. I appreciate it.
So tell us more about VENSA, how it came about, and is this your full-time gig now? Is that what you do?
No, it's not my full-time gig. I still practice veterinary medicine, as we all maintain full-time jobs to an extent. But VENS has kind of been a labor of love over the last 31 years. I started as a mixed animal veterinarian in West Virginia, and kind of moved around and owned my own practice. And I started teaching as an adjunct faculty at Arizona State University, and I started really enjoying the teaching process. So it became a major push for me. I ran a corporation called Veterinary Team Education Courses, 2000 through 2014, and have always been interested in speaking and talking about not just practice, but holistic approaches to medicine. In other words, how do we get the entire team involved? How do we look at everything? And along the lines, as I administrated and owned my own practice, I really saw a need for mentorship for new graduates, a system that is out there that can be utilized by really any veterinarian, but certainly the people who've been out for 1 to 3 years, that can be supported to make them prosperous, to make them confident, to make them feel comfortable in veterinary medicine, and mostly in today's world, to really understand what a general practitioner can do. And what happened was, my wife, who's also president of the corporation, and I had been on call at nights for some of our younger vets. And after a 3 a.m. call, we started to talk. And, she outlined the business plan and said, why don't you go write up a quick one pager discussing what we're going to do. And that was the kind of beginning of what VENSA became. So, we are hoping to develop, or we are developing a veterinary community that not just educates the new grad in general practice, but teaches communication, teaches the concept of team management, teaches how to approach the client, to educate the client to make educated decisions. I think the biggest challenges out there right now are new grads are coming out. They're afraid of litigation. They're afraid of being sued, which, it's a different world than when I graduated 31 years ago. They are taught by specialists, and whether subconsciously or consciously, they're nervous about making decisions without specialty. But there's 50,000 generalists in the US alone and 5,000 specialists. So you can't split them that way. And I really think that they really have to understand the importance of what they do and what they can do and when to get specialty involved.
So that's a really great topic, because right now, well, I want to hear your opinion because you're kind of monitoring this space. And what do you think, or how did the graduates evolved over the last 30 years? And what do they have skills more in, if they do? And what do they have skills less in? I'll just throw one sort of as a starter: surgery. Because when I graduated from Canadian vet school many moons ago, I at that point considered that surgery wasn't the skill that I was comfortable with because they didn't provide enough of. So I actually went to a different country to practice my surgical skills. But what do you think are there competencies that either evolve and they're better and people feel stronger about them, or they're less strong, let's call them, and then they need help with?
That's a good question. I think that can actually vary from school to school to an extent. I still think that that's true. I think there are schools that are stronger developing academics, and I think there are schools that are stronger producing practiced veterinary students. I think the problem is, I think both approaches are strong and excellent, but it's kind of like watching a movie without a lens. You've got all this knowledge going on in the background, but they don't know how to focus it. They don't know how to utilize that information to make a client understand the lay of the land, what comes next. They know the recommendations. They do a great workup. Sometimes they overdo a great workup, but they really don't know how to kind of, from that workup, go, okay, these are our options. This is what I'm recommending. This is some of the other options. Here are the pros and cons. What do you want to do? So that the owner can feel comfortable moving forward. Sometimes they're just overwhelming owners with information because that's what they have a lot of. But they don't have that, capability at that point to turn it into a, regular repertoire of, oh, this is how I handle blocked toms. This is how I handle an enterotomy. This is how I handle, a chronic ear. And I think that's what's really missing. And, I think there are programs out there, but I think what we do differently is, we're a complete program in as much that we're not just education, we're support. We work with excellent specialists like Dennis Chu, Benjamin Brainerd, Tom Graves, who see the importance of the generalist, who are going to be teaching general medicine for them, but also we have 90 minutes of communication, and each student will work with their own mentor for the entire 7 months of the initial boot camp, which is the initial part of the program. 7 months of boot camp, a different subject every month, about 4 hours a week, 2 hours twice a night, so they can do it while they work. It's interactive. The CE is race certified, and it's a certificate course. So the entire point is that in this 7 months, and the last month is a live active week of interactions, we're really training them in new technologies, modalities, communication skills, and we're doing it with new technologies so they can actually, in some cases, see through the eyes of the veterinarians themselves. The instructors are completely dedicated to their educational content. This isn't something where, unfortunately, I've been a part of mentoring programs where, they have somebody in charge of the program, but it's based on their big producers, and sometimes there's just not enough time in today's world. So this is a completely dedicated program. It focuses on not just education, but there are rounds, there are morbidity, mortality rounds, there's journal club, there's abilities to talk with specialty, there are discussion groups, there's discussions about interviewing, there's discussions about team building, there's the way that the participants can link up directly, very quickly through the platform. It's a complete supportive center so that they can ask the questions, get answers right away, and, have their trial by fire with us before they go into the next room.
That's so interesting, Andrew. So, one of the things that I think is a hot topic now for the entire industry is, is hiring new grads and,
Right.
securing them before, somebody else does. It's unbelievable. Me and Ivan are both up here in Canada, and within the last 6-8 months, I've seen US based corporate consolidator groups coming to Canada and actually hiring veterinary students that are on their payroll to help convince people to come work for them. So there's tons of challenges in hiring people. There's not very many to hire compared to what the demand is. But other than just hiring and then getting them in the door, what are the challenges that you guys are trying to solve with these new or recent hires as they kind of come and go through your program? What's the vision?
Well, the vision is that, quite honestly, as you said, knowing the US market, we've gone from 55% pet ownership to 70% with the pandemic. Those numbers aren't going to change quickly because the animals aren't going to disappear tomorrow. And, there is such a need for veterinarians. But the problem is when you do a new hire, people are so busy and so, the resources are, so thin that, there's just not that time to let me see what you're doing. Let me listen. Let's plan this out. Let's sit down. Let's do a session a week. So they're not tremendously productive. They're not assured of themselves, and they're not getting the type of support they need to grow. So a lot of these people will get frustrated, get burned out, leave veterinary medicine in general practice, go into other areas of veterinary medicine. And, it's great to throw $30,000 to $100,000 at a new graduate for signing. But once you've got them there, there's nothing to support them. There's nothing to help them grow, to make their mistakes. When I graduated in 91, there were no specialty. So when I was doing emergency at midnight in West Virginia, I was the only veterinarian awake for 400 miles. So when I made a trial by fire, it was trial by fire, but it didn't have that kind of impact. There weren't web pages with good, bad, and intermediate material that the clients are reading while you're talking to them. And, it's a tremendous challenge now to get these students comfortable in their skin, knowledgeable, reasonable, and to meet the goals and the pressures that are on them every day.
So, on the topic of the specialist, this is the referring frenzy, I would call it. I've been a ER vet my entire career, and there was a lot of trial by error, and luckily I haven't been sued a single time, and that's kind of how it went. And I also was, the only veterinarian in the large area, and then I did work in the hospitals with a specialist. But right now, we're sort of at this a crossroad where we don't have enough vets. The vets that we have refer. There's no specialists, so there's not enough to refer to specialists. And I think that we're evolving into a different, like something needs to happen. I really love, we had this interview with a service called Vet CT. So basically they are a referral group of specialists globally.
Yeah.
And 24/7 you can access specialists for consultancy. So, what do you think about the whole direction where the specialty medicine is going? Hiring specialists is impossible completely
Right.
right now. There's just crazy sign up bonuses. So, do you see us moving a little bit back from the direction that everything needs to be referred, or are we going to continue even more not allowing veterinarians to practice at the top of their license? Or is there an opportunity to do more? Because we can. You don't have to be a specialist for every ultrasound, fine needle aspirate and everything else.
Absolutely. And I think that's the point. I'm not dissing specialty at all. We need to know when to utilize it, but there are new graduates out there that are not doing any surgeries. They're referring cystotomies. And there are, I'm getting complaints from specialists. Like if I see a chronic ear that hasn't been handled correctly, just by, putting it through setting expectation and doing proper things, I don't know what we're going to do. We can't become push button culture in veterinary medicine. We're not set up to. It's nice that we can ask specialists. I'm all about it. It's nice to get them to specialty when it's important, but we can't forget who we are, that we are generalists, that we do have the capability of working up cases, especially in areas we're comfortable with. There are some great generalists who are good orthopedists, surgeons that are good ultrasonographers, and it doesn't mean that they're specialists, but they certainly can, work up a case and go, okay, this is where I'm comfortable. This is where we're going. This is the progression we made. And now you need to go to specialty. But I think that process has to be done. The problem is that new graduates will see a chronic ear or a chronic renal failure patient or a chronic GI. And, if the initial medicine doesn't work, that's all they do. We really need to go back to an extent, understanding where we came from. I don't think working up a, chronic GI issue to the fullest capability of our practice is, pushing our license. I think it's part of our license. I think then when we go, okay, we either have to go to specialty and have a biopsy, or we have to treat dietarily and medically, are the roads we can take. And this is what we're looking at if we go in this direction, and this is what we're looking at if we go in that direction. And what are your needs and where do you want to be? Because ultimately, I just need to inform you of the pros and cons and help you make a decision. And I think that's where we need to be. And I think there's so much fear with that. Interestingly, a side note, one of my favorite younger emergency vets that I've been working with, absolutely sharp as a tack. We were talking over a case one day, it was Friday afternoon, and I asked, okay, we have a standard idiothrombocytopenic patient, an ITP patient. What do you want to do? And it was just a normal low platelet patient. Could have been anything, but it wasn't, an immune-mediated hemolytic anemia. It was a immune-mediated thrombocytopenia. And she looked at me and said, I want an internist. And I'm going like, it's 7:30 on a Friday night. I don't think you're going to get an internist. So, I mean, these are things that we can handle. We can handle them to a point. And then when you get into the zebra category, that's when we need to get internal medicine involved. We need to talk with them. We need to understand where they're coming from. We need to add their approaches to our repertoire. But ultimately, we need to take them there.
Yeah, that makes tons of sense, Andrew. I think as the non-veterinarian on the show, but it sounds like it does. You're very convincing. My next question kind of takes us over to the technology side of the house. It sounded like you hinted at doing some unique things, leveraging technology to kind of really scale this program up. Can you kind of help us understand what's behind the curtain?
Sure. Like I said, there's going to be a lot of discussions of newer technologies, but one of the things what we're looking at incorporating is the use of special eyewear for at least the architects at first, the instructors. And the eyewear allows the utilization of recording and doing procedures as if you're looking through your own glasses. So we're going to give them a very, front row seat, if you will, wet zone of what we have to deal with when we're dealing with a bleeding abdomen or a pneumothorax or something that is challenging that they may have never seen close up. As we go further, we may take this technology and give it to the students so they can interact with the clients, and we can kind of see exactly where the clients aren't participating, where the clients are getting lost. Because, it doesn't take long. If you've been in a room as long as probably you and I have been, I can probably tell you within about 10 seconds if the client's going to go for it, or if, when I mention price and their eyes go up to the ceiling, I'm like, okay, here we go. But I can get a good feel for it at this point. That's something that you have to teach. And we have a very, very talented instructor of leadership who I've worked with for 20 years in the veterinary space, and she's worked in other spaces, who is really going to focus on how to teach basic communications. Everybody's going to be disc analysis. They're going to be discussed, the pro points of communication. They're going to be tested on it. Because again, it's not just how I communicate, it's how you communicate and how I identify your communication style so that we can find a common level.
Yeah, so interesting, and so interesting to see like a bunch of our past episodes kind of colliding on top of each other here. It's really interesting what's going on in this space. So talk about the platform itself. Is there a platform? What do people log in? And, we've got people listening that are probably saying, oh man, I could use that for some of my new students. So what would they do if they were interested in doing that?
Well, we have a website called VENSA, VENSA, veterinarytraining.com. It goes through some of the basic information. They can email us, or we can call them, or they can call us directly. We're going to use a platform called Thinkific. Thinkific is a very common platform for a lot of educational sources. It allows them to actually plot what they have to do academically to get the certificate while also getting the CE credit. Another kind of interesting thing is we'll be utilizing a lot of interactive case studies. As they've done a study, they can actually move through the information and kind of test themselves on it. And then they also have the ability of meeting for 30 minutes every week with their mentor. These are people who've been out 20 to 30 to 40 years. some are retired, who created businesses before the world was specialty and have done very well. And these people are a very diverse group, coming from multiple areas. And the entire point is that it's important for a young, female veterinarian to hear another female veterinarian said, look, I've been out here, I have done this, I own my own hospital, and this is how I grew. So those voices are also extremely important, which is something that nobody else does either.
Yeah, as we rounding here, we're through 20 minutes as usually. But one thing that rolls in my head is, if all the new grads are so afraid to not refer the case and they're sending cystotomies because they're afraid to be sued, I'm wondering if in the vet schools we should start scaring them and saying, by referring a case that you could do yourself, you could get sued. Maybe that will turn them a little bit around, that if you send cystotomy to a specialist, that's not practicing to your license.
Well, and that's the point. I mean, there is something intoxicating about working up a case to its fullest, interacting with the client, stabilizing that patient, making the client understand, making them happy, making the pet happy, increasing the human animal bond, and seeing that through, lifetimes of your clients. It's why I signed up.
We're at the top of our 20 minutes. We asked 2 questions at the end of the show. One of them is, what is the book, TED Talk, YouTube video, or something that you would recommend to our listeners?
Well, I'm going to be a little self-indulgent. One of the things that I think is a good resource that I wrote based on my many lectures as I lectured in the circuit would be the Veterinary Medical Team Handbook. It's been out for a while. It's a training guide for the veterinary hospital team. It starts at a very basic level and moves more to advanced levels as it goes through anatomy and physiology to clinical diagnostics to treatment. And I think that gives you another road to see how we're going to be approaching these new graduates in not just looking at the medicine. It's the entire picture.
Awesome.
Excellent.
And then the last question is another innovator that you think we should have on the show, Andrew.
My goodness. One of my favorite people to listen to is probably Dr. Dennis Chu from the Ohio State. He's an emeritus at this point. He has been working on the same urinalysis textbook for about 3 decades, but I think it's finally coming done. He has unique perspectives on medicine. He is one of our lead instructors and a pleasure to talk to.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinarynnovationpodcast.com. See you next week.